Because a vaccine against SARS-CoV-2 is not expected to become available until 2021 at the earliest, a key part of managing the COVID-19 pandemic is trying to decrease the epidemic peak, known as flattening the epidemic curve. This helps decrease the risk of health services being overwhelmed and provides more time for a vaccine and treatment to be developed. Preventive measures to reduce the chances of infection in locations with an outbreak of the disease are similar to those published for other coronaviruses. Stay home, avoid travel and public activities, wash hands with soap and hot water often, practice good respiratory hygiene and avoid touching the eyes, nose, or mouth with unwashed hands. Social distancing strategies aim to reduce contact of infected persons with large groups by closing schools and workplaces, restricting travel and canceling mass gatherings. According to the WHO, the use of masks is only recommended if a person is coughing or sneezing or when one is taking care of someone with a suspected infection. To prevent transmission of the virus, the U.S. Centers for Disease Control and Prevention (CDC) recommends that infected individuals stay home except to get medical care, call ahead before visiting a healthcare provider, wear a face mask when exposed to an individual or location of a suspected infection, cover coughs and sneezes with a tissue, regularly wash hands with soap and water and avoid sharing personal household items. The CDC also recommends that individuals wash hands often with soap and water for at least 20 seconds, especially after going to the toilet or when hands are visibly dirty, before eating and after blowing one's nose, coughing, or sneezing. It further recommended using an alcohol-based hand sanitizer with at least 60% alcohol, but only when soap and water are not readily available. The WHO advises individuals to avoid touching the eyes, nose, or mouth with unwashed hands. Spitting in public places also should be avoided. Management. 4 steps to putting on personal protective equipment. There are no specific antiviral medications. People are managed with supportive care such as fluid and oxygen support. The WHO and Chinese National Health Commission have published treatment recommendations for taking care of people who are hospitalized with COVID-19. Steroids such as methylprednisolone are not recommended unless the disease is complicated by acute respiratory distress syndrome. Intensivists and pulmonologists in the U.S. have compiled treatment recommendations from various agencies into a free resource, the IBCC. The CDC recommends that those who suspect they carry the virus wear a simple face mask. Technology management of people infected by the virus includes taking precautions while applying therapeutic maneuvers, especially when performing procedures like intubation or hand ventilation that can generate aerosols. The CDC outlines the specific personal protective equipment and the order in which healthcare providers should put it on when dealing with someone who may have COVID-19 to 1. Gown, 2. Mask or respirator, 3. Goggles or a face shield, 4. Gloves. In February 2020, China launched a mobile app to deal with the disease outbreak. Users are asked to enter their name and ID number. The app is able to detect close contact using surveillance data and therefore a potential risk of infection. Every user can also check the status of 3 other users. If a potential risk is detected, the app not only recommends self-quarantine, it also alerts local health officials. Experimental efforts. Antiviral medication may be tried in people with severe disease. The WHO recommended volunteers take part in trials of the effectiveness and safety of potential treatments. There is tentative evidence for remdesivir as of March 2020. Lopinavir/ritonavir is also being studied in China. Chloroquine was being trialed in China in February 2020, with preliminary results that seem positive. Nitazoxanide has been recommended for further in vivo study after demonstrating low concentration inhibition of SARS-CoV-2. Psychological infected individuals may experience distress from quarantine, travel restrictions, side effects of treatment, or fear of the infection itself. To address these concerns, the National Health Commission of China published a national guideline for psychological crisis intervention on the 27th of January 2020. Prognosis. Many of those who die of COVID-19 have pre-existing conditions, including hypertension, diabetes and cardiovascular disease. In a study of early cases, the median time from exhibiting initial symptoms to death was 14 days, with a full range of 6 to 41 days. In a study by the National Health Commission (NHC) of China, men had a death rate of 2.8% while women had a death rate of 1.7%. In those under the age of 50 the risk of death is less than 0.5%, while in those over the age of 70 it is more than 8%. No deaths had occurred in people under the age of 10 as of the 26th of February 2020. Availability of medical resources and the socioeconomics of a region may also affect mortality. 100. Histopathological examinations of post-mortem lung samples showed diffuse alveolar damage with cellular fibromyxoid exudates in both lungs. Viral cytopathic changes were observed in the pneumocytes. The lung picture resembled acute respiratory distress syndrome (ARDS).